City commuters can rest easy for now. The MTA has postponed fare hikes, but will there be any service changes? That's the question we're asking this morning. And so joining me now with an update is the MTA chairman and CEO, Pat Foye. Good morning to you once again, Pat. How you doing?
Good, Dan. Morning. How are you?
Doing well, sir. Thank you. I wish I could count how many times I asked you about a fare increase, right? We had that conversation over and over again. You're postponing the fare.
12 times.
Well, you counted. You did your homework. There you go. So let me ask you, my new question will be, for how long will there be a postponement in a fare increase?
Dan, we've put it off for several months. Look, we are acutely aware that lots of our customers and our friends and neighbors in the region are suffering from the pandemic and the financial fallout from that. We're encouraged by, frankly, the inauguration of the new president, who's a longtime supporter and, just as importantly, longtime user of mass transit. The COVID relief bill that was passed in December gives us $4 billion and will cover our deficits, almost all our deficits in 2021. And we're optimistic about a new COVID bill. The other thing is the ascension of Senator Schumer, the Senate Majority Leader, first ever from New York, is great news. I believe Senator Schumer is going to be one of the most important majority leaders in the history of the Senate. There's lots of reasons to be optimistic. Yeah. We put this off for several months.
And Polly Trottenberg now as well, former MTA board member as well, joining the administration. I want to ask you, though, about tolls, because while we're postponing the fare increase, will there be a hike in tolls, and how much?
Our board's going to consider toll increases at the February meeting. I expect that the toll increases will be passed. The public notice that we put out, which sets the parameters of the increase, range from 4 to 8% increase on tolls. The tolls, frankly, are important because the revenues from tolls subsidize mass transit, subways and buses. Passenger car volume and truck volume on our bridges and tunnels has come back strong, as it is in other parts of the country. It's not quite yet at pre-pandemic levels, but it's approaching that, between 82 and 90%, depending on the day. Area roads are congested. Air quality is being challenged. What we'd like to do is to move some of those commuters to mass transit.
Just to play devil's advocate for a second, I understand you factored in some of the concern you heard from subway riders saying we don't have the money for a fare increase. Don't drivers have the same issues, are you assuming they can afford it?
Well, look, if you've got a car and can pay the toll and parking, you've presumably got a somewhat higher level of income. We don't think that every one of our bridge and tunnel customers is a hedge fund executive, but generally there are higher income earners. I will say that our subway and bus customers at this point are essential employees and first responders. Many of them are low-income workers and members of communities of color.
Right.
The policy and financial reasons for increasing tolls, including the subsidy of subways and buses, is clear.
Understood. I want to get to growing safety concerns as well for passengers as well as MTA workers, right? We heard yesterday from the top transit cop chief, Kathleen O'Reilly, who said subway crime is actually down. So do you feel that subway crime is down, or is there a necessity to have more police in the subway system?
Our customers and our employees don't feel it's down. First, we're really happy to have Chief O'Reilly on the scene. She's added more forces to the Transit Bureau, and she and her troops are riding subway cars and platforms. Having said that, there have been some really horrific and unacceptable instances of emotionally disturbed people pushing people on the tracks. Frankly, the city has to step up in terms of care for those who are emotionally disturbed. And frankly, the DAs, both with respect to attacks on transit workers and with respect to just attacks in the subway, we'd ask for more. We need more aggressive prosecution.
And do you think there needs to be more? Do you think there needs to be more police? Do you think there needs to be more police in the subway?
We do need more police, and frankly, we need more resources from the city to deal with emotionally disturbed people in the subways.
Understood.
Most of those incidents that you're referring to and those that create angst on the part of our customers and employees have been done by emotionally disturbed people. There's a real mental health crisis.
Pat, we're almost out of time here, but I want to get to COVID and the vaccines, right? More than 130 MTA workers have lost their lives, as we've talked about in the past, including 4 just this past month. My condolences to their families. Yesterday, Dr. Fauci released a message to MTA workers to amp up vaccines. I want to just play a quick snippet of that message.
Throughout the U.S. pandemic, you have kept New York City's public transit moving. That is why you are essential workers at the front of the line to receive a coronavirus vaccine. Take advantage of it. Get vaccinated.
There from Dr. Fauci, but at the same time, New York is running low on vaccines. What are you hearing in terms of vaccine numbers for the MTA? We already heard from the FDNY and NYPD saying they have to hold off.
Yeah, look, the reality is that the federal government has been disappointing, and obviously we're encouraged by the Biden administration aggressively attacking the issue. But as Governor Cuomo has said, demand for the vaccine far exceeds supply. That's true with respect to the MTA. We're happy to report that in the first week or so of vaccinations, we vaccinated 1,300 of our frontline employees. They want to be vaccinated. Every dose that's allocated to the MTA, we will put in the arm of an MTA frontline worker. Dr. Fauci's statement yesterday and his visiting the board meeting by video affirms that. Transit workers and MTA employees are smart. They want to be vaccinated.
But in the meantime, do you have to postpone appointments like the FDNY and the NYPD have done?
We're limiting appointments, Dan, depending on the availability of the virus. We're working closely with the state, which has obviously put up this incredibly efficient facility at Javits Center, and the MTA will be putting up also facilities for our employees to get vaccinated, but it's all dependent on supply from the federal government.
Understood.
Governor Cuomo's made that clear.
MTA Chairman Pat Foye, always appreciate your time. I got to come up with a new question for you that I can ask you 12 times in the future. I'll figure it out, and we'll get back to you.
It's a deal, Dan. Look forward.
MTA Chairman Pat Foye, thank you.